Good afternoon, everybody. This is the Board of Health's January meeting. I'm John Strand. I will be substituting as chair today. And bear with me as I'm rather new to this board this cycle. So if I learn names and people's roles as we go along, help me make sure I don't goof up. So again, I'm John. I'll run around the table and we'll start way over with on my left and do introductions and then go over to the staff and to those microphones to hear who's with us over there as well. So just please introduce yourselves and tell us what you do.
My name is Jamie Stagg. I'm a board member and I am a pharmacist by trade.
Grant Severson, I'm a pediatric rheumatologist.
Jim Capitan, Cache County Commissioner.
Okay. And do we need to do a roll call other than that, or is that adequate? Should be adequate. And there's nobody on the line that I know of joining virtually or on phone? Okay.
There are people
But,
online.
but not members. Okay.
Oh.
We have a reduced membership of this board at the moment, so our quorum numbers are lower because we have 3 vacancies that are not sitting yet and appointed to the board. So we have a lower threshold and a lower quorum and a lower number of people participating. So that said, we'll go on with the agenda, and I'll call for a motion to approve the agenda as it's presented.
Motion to approve.
So moved. Is there a second?
Second.
All those in favor say aye.
Aye.
Opposed, nay? Okay, we're on path with the agenda. Could I have a motion, please, to approve the minutes of the December 6th meeting?
Motion.
Moved. Is there a second?
I'll second.
All those in favor say aye.
Aye.
Any opposed, nay? Okay, those minutes can be posted as they're written. We'll, at this point, go on to the health officer job description review and discussion for an RFQ, and I'll turn this, I believe, over to Jen. It will be to you, Jen. And can everybody hear okay? We're in a different format. And not every, they're sitting up here is different than at the floor, but we'll see how this works. Oh, I'm sorry. I didn't do introductions, did I, over there? Let's go over to the tables, then we'll go on with the agenda.
Thank you, Commissioner Strand. Jen Paul-Fargo, Cass Public Health Director. And this sounds really loud to me sitting on this side. Is that loud for you guys?
What?
Thanks for that, Jim.
Okay, thank you. Continue with intros, please.
I'm Dr. Jessie Lindeman, Family Medicine. I'm the interim public health officer.
And welcome. We'll be hearing
Thank
from
you.
you.
Hi, I'm Holly Scott. I'm the Public Information Officer at Fargo Cass Public Health.
Lori Sal, Principal Office Associate.
Jan Eliason, responsible for harm reduction programs, Fargo Cass Public Health.
Melissa Perla, accountant at the Health Department.
Suzanne Schaefer, Director of Nursing at Fargo Cass Public Health.
Good afternoon. I'm Larry Annenson, Director of Health Protection and Promotion here at Fargo Cass Public Health.
Good afternoon. Grant Larson, Director of Environmental Health at Fargo Cass Public Health.
Anybody else over there? I know we have Commissioner Kolpak in the audience and Nancy Morris, our legal counsel, and I see Dr. Mahoney, Mayor, walking in, so we have a good attendance of electeds as well. Now,
Online, we also have Doug Murphy, I believe, is online with us from Emergency Preparedness.
great, thank you. Now, Jen.
Yes, I am.
Okay, now do we go on to the next health officer action item? And will you introduce that, Jen, or who will preface that?
Sure, I can.
Thank you.
Are we doing that first slide? Thank you. I would first like to have Dr. Lindeman, or actually do the announcement for the Board of Health members who are off-going. We have Kayla Nelson, Lynn Telford, and Naeem Aldai, who have discontinued their terms had ended December 31st of 2024. There's a gift that will be going out to them. It's a thank you bouquet, figurine, and a certificate that will be mailed. Their names are not on all of the certificates. Each one will get their own. But for purposes of this, just great appreciation for them, their years of service to the board and to public health. So thank you to them, and you can look for that in the mail. And then we would also like to welcome Dr. Jesse Lindeman, who is our interim health officer, who will be with us through April of 2025 while we're completing this particular review of roles and responsibilities for the health officer position, and then also posting the RFQ for the permanent placement of the health officer role. Would you like to do a brief introduction as well?
I'd like to just say thank you for the opportunity to serve the city of Fargo and Cass County. I grew up in Fargo, moved away for a while and made my way back here. I went to UND for medical school and left again to Wisconsin to do my family medicine residency, but made my way back again. And been practicing family medicine for over 10 years. Live in North Fargo with my husband and my daughter, 12-year-old at Ben Franklin. So just happy to be serving the community. Thank you for the opportunity.
Unbeknownst to me, a little bit more on that was when she came into Fargo Cass Public Health, it was almost like a homecoming to our clinic, as she had done rounds as a medical student with the nurse practitioners and the family planning clinic. So they were very happy to see her back and have her expertise back in-house for a while. So thank you for coming.
Thank you, Dr. Lindeman. And you're not the first Lindeman in the medical field in town, are you?
No.
I was going to say, I think that's a pretty common name over the years. Welcome, and we look forward to working with you. And don't hesitate reaching out to staff and any board members with any issues or concerns, so we can all do well together. Okay? Anything else on that, Jen?
With the rest of the conversation, to have the health officer, the role of the health officer, I believe, is the next piece on the roles and responsibilities of the health officer. There was an attachment in the invite and perhaps has been printed and is on some papers for you for review. And this is for us to have the conversation of approval for the role and responsibilities of the Fargo Cass health officer before it goes out to an RFQ that we would hope to have sent out rather soon to be able to receive applications and have the person in place. Dr. Lindeman is aware that she has the capacity to apply for and stay on as the permanent health officer. And if she chooses to do that, great. Otherwise, we'll be completing and still moving forward with the RFQ process for other qualified candidates to be able to apply to the position. So I wanted to supply with you the first section of the roles and responsibilities of the health officer are as quoted from the North Dakota Century Code. That is all of number 1. And then number 2, and the rest of the job description really is completed by review of the division directors stating what they needed to have completed within their divisions that are roles fulfilled by a health officer or ways in which they'd be supported by the role of the health officer. So if you have any questions on those, our team is here to be able to respond to those. And then just asking if there's anything additional that you would see a need for that you would like to have added to the RFQ.
Okay, I'll open it up to board members. Any feedback or suggestions? Jim?
None from my side.
Dr. Severson?
Yeah, I had a question. Is this the current, is this what the current the role looks like for the department that we previously had for the health officer, or has it changed since then?
It has changed since then.
What's different?
This is what Dr. Lindeman is actually fulfilling at the current time, and this is what we're proposing to post for the RFQ.
What's the difference between the two?
The previous job description and roles responsibilities was a much broader contract that we had with NDSU, and the hours would be different. The expectations that were listed out previously they're actually much more extensive than what we are asking to be completed here.
And this is for the 5 hours a week that you have been requesting?
Roughly less than that, probably around 4 hours is what we expected.
Okay. Is there any discussion of public education or educating the public about public health issues in the roles and responsibilities?
there isn't listed in this.
I think that'd be something that would be important. I think the public health officer has a pretty, forward-facing role for the public to give them information about different things, so I think that'd be nice to have as part of that.
Thank you.
Dr. Severson, just for the sake of process, my thinking is perhaps you advance that in a motion to modify the proposed qualifications to add that. Would that make sense?
Sure.
Just so we're not just assuming anything, if you'd.
Can I have a motion to add that to
Please.
modify?
We have a motion to modify that. Is there a second?
I'll second that.
Any further discussion or feedback on that?
I would add that to Dr. Severson's comments, that was the one responsibility that kind of stood out to me as possibly missing that reporting and community advocacy role that's needed unless you have plans in place already for others to cover that, I guess.
And are you referencing the education that was done through the, through this particular meeting where there was a PowerPoint that was reviewed, or are you talking more?
More community events and presence within the community to support and advocate for public health and current issues.
Okay.
So Dr. Lindeman, you're going to have to put on your PR hat and do media interviews and you already know that anyway. That's good feedback. That's also a really good suggestion. Anything else on this a motion for amendment? Dr. Severson, is it making sense what you're advancing?
Yeah.
Okay. Anything else? If not, I'll call for a vote. All those in favor say aye.
Aye.
Any opposed, nay? That's been modified. Any other suggestions for these responsibilities before we put it out for an RFQ?
The only other question I had was, it discusses monitoring disease outbreaks in the community. Is there any role for kind of a broader disease outbreaks in the United States or in the world as far as information about that, so we can be prepared in case they do become local? I don't know if people have thoughts or feedback on that, but unless that's serving as liaison to the NDHHS Disease Council.
Dr. Severson, if I could just ask a clarification. We frequently partner with North Dakota Health and Human Services with disease control and our regional epidemiologist.
Yeah.
Are you just suggesting you'd like to see that continue, or are you
Yeah.
suggesting a different approach?
No, I just wasn't sure if that was included in that.
Sure. I think that's one of those things that's kind of implied, or just assume that it's an ongoing, partnership or relationship, that we continue to work closely with our state partners.
Okay, great, thank you.
Sure.
And we have two epidemiologists that still work within the Fargo-Cass part, Brenton and Jenna.
Okay, thank you.
It's a really good point you raised, though. Something that might be happening on the other side of the globe and coming our way, or that we've seen that. So, do you think there's a need for a modification, or is the implication implied meaning adequate?
I think if the public health officers feel, or board, or the department feels like it's taken care of, then I'm fine with that.
Okay, well, that's a good point, and our intention now is clear that it includes that. Any other suggestions for this? Anybody else? If not, I would entertain a motion to approve the RFQ as amended, so the health department can go forward with it.
Motion.
So moved. Is there a second?
Second.
Any further feedback or discussion? All those in favor say aye.
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 Opposed, nay? Okay, we are, that is going forward, and Jen and team, it's with the amendment as proposed and approved by Dr. Severson and the board. Okay,
I did have one question not related to this per se. Maybe I should ask it at the end.
go right ahead. Sorry.
Who's all on the, interview committee for the new public health officer?
I would have that probably with all of the directors and the leadership for Fargo City of Fargo.
Nobody from the Board of Health would be on that?
I'd bring it for you guys as well, but it would be we would get all of those applications. I'm not sure exactly how that process had been played out previously.
Sure.
But to bring candidates to you, you would make recommendations, I believe, to the commission for potential hire of the health officer.
We wouldn't be involved in the interviews per se.
Pardon?
We wouldn't be involved in the interviews at all?
I haven't established that. I'm not excluding that. I haven't even gotten that far yet, to be honest with you,
Just
Grant.
curious.
But what I hear you suggesting is that's not maybe a bad idea if there's room and opportunity to include some board voices
I think so.
in the interviewing process. Is that all?
Correct,
That's how I'm
yes.
hearing that?
Yes.
So we're all on the same page?
Yep.
Okay, good feedback. Anything else? All right. We'll go on to the Community Health Needs Assessment. And who will introduce this to us?
I believe that'll be Jen in just a moment.
Okay.
I'm taking notes as I'm going through some of these things. So the Community Health Needs Assessment was one of the first things we started talking about in the very first meeting I had with you. And you had received the email invitation to this meeting that had the community health assessments from Sanford and from Essentia. Sanford's is the 2025 through 2027, and then Essentia's was the 2023 through 2025 plans. And we have reviewed those as a team at Fargo Cass, and then had also been part of an email string of other folks from the community who have been working on their community health assessments and implementation plans. From Sanford, Chase Greer, who is the strategic planning advisor, Allie Fast, who is from Essentia and the community health program manager there, Rebecca Schmidt from Clay County, Andrew Weiss from Sanford, Julie Sorby-Ingen from Family Health Care, and Kathy McKay from Clay County. And they've been meeting as a community health group and hadn't met, I think, since August. And I'm working to have a reconvening of that body of people to work towards our community health improvement plan, community health assessment for Fargo Cass Public Health. When we met, we highlighted what the current priority areas are, or that have been identified by Sanford and by Essentia. Essentia unofficially so far has talked about having their next round of community health priority areas being that of the social drivers of health, nutrition and physical health, and housing. And so as we were starting to have this conversation within our own leadership as to what are the things that Fargo Cass should be doing, ought to be doing to kind of fill some of the gaps of things that aren't being done or met within the community, these are the ones that are not being addressed. Access to affordable health care, healthy living, public transportation, quality childcare, and affordable housing that were identified. And we were looking at those to seeing, like, what can we do? Where's our place to fill some of those needs? We started looking at the healthy living category, and that's a very broad umbrella for healthy living categories. All the things that are including in there, talking about whether that's the vaccinations, nutrition, exercise, and obesity issues that exist, heart disease, and there's a whole category of things that we talked, and I want everybody to have an opportunity to visit about this, and it's hard to have this engagement when they're behind me, but looking at having us fulfill more of that promotional piece, prevention and promotion within the community activities. But there are also places, if that's the heavier lift that we have, there are also places that we feel like we can supplement those other areas with the priority areas identified by Sanford, like the substance abuse, mental health, and even the housing initiatives that we've already been working towards. So with that, like, we're gonna, some of us will meet with folks at Sanford to talk about ways in which their identified areas already are in line with some of the things that we've been doing or are hoping to do in the near future, but where are the ways in which we can collaborate, and what are the things that Fargo Cass can do, and just really wanting to work with the board to help establish where you would see us going in our next rendition of the Community Health Improvement Plan.
Jen, is there any action required on this?
It's a conversation.
It's a conversation.
It's an ongoing work group, and I don't know if and how we get to work on that through this format, or if there's a work group kind of format that we get to work on in the development of our assessment and community health improvement plan strategy.
What feedback do the board members have?
I would say these are fairly broad topics to discuss over a noon meeting. So I do think a work group would probably be a better idea to assess this and make a plan and then present it to the board in the future.
And who from the board would want to be part of that? Is there an opportunity for us to work again? Okay,
I can be part of it.
excellent.
Okay, anybody else would like to volunteer? That'd be great. Jen, I'm the king of dumb questions. And I'm looking, and I'm rather new here. And I'm not sure if I see demographics and breakdowns of community information, but one of the most, and I raised this at one of our previous meetings when we had students presenting, but to me, one of the most pressing issues in the community is the lifespan of Native Americans in our state. It's 20 years or more less than me, and or more. And I just want to see us put that front burner. Why are Native Americans living so much less? What are the contributing factors? What are the socioeconomic roles and influences? And what can we do? How can we make this a front burner issue? I really believe this is a pressing community issue. And, you know, and the first time I heard that this data was about 10 or more years ago, the lifespan of a Native American male in North Dakota, I was told, was 57, and I go, 20 years less than me. And then more recently, post-COVID with the MHA Nation, I anecdotally heard that it was down to as low as 52 lifespan. So again, I'm just raising this topic. I think this should be something we make a focal point of our work going forward. And I know there's mentions of diversity in BIPOC communities and others, and poverty and other social influences in here, but my personal request would be to have us, and I also sit on the Native American Commission and have for 10 years. So that's one personal advance from my perspective that would be really terrific for the community in a public health arena to address that segment of our population and why and what we can do and what our avenues of support are. And that's just my thoughts, okay? Anybody else have information to inject or feedback or contribute to this?
I agree. I think investigating that issue would be very important.
And I don't want to assume anything, but so your work group, and you're going to be on that, Dr. Severson and Jen and the crew. Let's, if you don't mind, and I can connect us if you need to Native leaders and Native health providers and folks in the community like that would maybe be resources. Anyway, any other follow-up or feedback on the community health needs assessment topic? I see Mayor Mahoney coming to the microphone. Thank you for joining us, Mayor Mahoney, Dr. Mayor Mahoney.
Well, John, we just love to fact check, and fact checking right now, when I go to Google search, life expectancy has improved to 65.2 years. And your life expectancy also has improved to 77 years. So it's a good point to make, and we should look into this, but I just wanted to say we've made some improvement for whatever reason.
Is that a North Dakota life expectancy or global or?
Just for the United States, basically.
Okay. This is good. It'd be good for us to get agreed upon
But that,
data.
you guys can look that up.
Because I know Sharon Whitebear had been tracking this for our community for a while, and I'd be up wanting to know what the current status is, especially in North Dakota. Thank you, Mayor. Anybody else? Jen, and there was no action required on that?
I was hopeful for conversation and getting people, and not knowing, I guess, how do we get to work together? And this has always been kind of the thing I've grappled with. How do we get to work together outside of this meeting, I guess?
So if we were to formally appoint somebody to a committee, then that changes the dynamics somewhat. But we have a volunteer. Do you need other volunteers?
I'll take whoever wants to be part of it.
All right, let's leave it at this. If anybody, and in the public, are you open to people in the community?
There is a community group already from the different agencies, and so I think a community member at large would be fine as well.
Great.
Getting feedback.
Okay, and we'll give you the permission and direction to go forward with this subcommittee with these participants and then report back accordingly. Does that make sense?
And there may be an opportunity if we fill the other board member positions for them to participate too.
Yeah, we have 3 vacancies here, which could affect your dynamics as well. Dumb question again. This has no connection at all to the health survey through the school district, does it? That's a different beast completely?
Correct.
All right. And is this an ongoing, regular, annual thing, or is it just a process we can get, well, what's the timing line of it, Jen?
This would be done, and it should last roughly 3 years, 2 to 3 years.
And in that process, are you building dynamism into it, keeping it alive, keeping it front burner, revisiting it all the time?
Correct, yes. We had visited previously about some of our transparency with data, and that we've been looking at the Clear Impact website. There are several of us currently that are demoing that website in a way in which we can input data and build out our databases on it, and we'll bring that to the rest of the directors to be able to look at and get oriented in before we start populating and then airing our data. So when we establish our the plan would be when we establish our implementation program, that we'd be able to have our goals and objectives there, and you'd be able to track data and seeing how we're performing.
And Jen, bear with me, but we have Sanford and Essentia. Are other medical providers going to be at the table, like Prairie, St. John, or Veterans Hospital, or any of those others?
I didn't see those currently in the group that had been established. I'm the newest member to that group, so I can visit. I know historically when I was at Prairie that they were at the table when we had done this years ago.
Especially in the lens of equity and access, if we can make sure that there aren't any marginalized parts of our community that aren't represented.
Understood.
If that makes sense.
Having had relationships with North Dakota DHHS and having the New American Foreign-Born and Immigrant Population and liaisons that we have here in Fargo be part of. And then also there are tribal liaisons that have been instrumental in guidance on other policy and information that we can have them be part of as well, and making sure voices are captured and needs in our community are captured through their representation. That is something that NDHHS was recognized by SAMHSA for, by the amount of data and exchange with our tribal leaders.
Okay, and I see Jan Eliason in the room. Jan, is there anything with regards to harm reduction or homelessness that we need to interject into this conversation for community health needs assessment? Anything you see that is on your radar to point out to us?
Nothing that you haven't already touched on. I think taking a look at race and ethnicity is a huge factor. We know that people are overrepresented. People from other racial groups are overrepresented. I think the affordable housing piece is already being looked at, and the impact of homelessness on, for example, you brought up lifespan. The impact of homelessness on lifespan is considerable once somebody's experienced that, just the usual things that we've already talked about, I guess.
Okay.
Race being the marginalized populations, and race probably being the ones that I would push the most.
That's very good feedback for all of us. Anybody else in the staff or team have any suggestions for the board to contemplate as we're going forward on this? Or any board members or anything else? Jamie?
Well, I wanted to ask, this was a good review of the Sanford and Essentia Community Health Needs Assessments, good identification of the gaps that are not being addressed. Are there any other findings from your internal data beyond, the existing community needs assessments that are areas of need as well? Or how are you using your internal data to help support and identify issues as well?
And we are just starting in that process. And this is our first review of this and forming a team. So literally this week, we had reviewed for about 2 hours the external data and coming to these conclusions so far. And then looking at the bigger pieces of where we've identified some of the needs internally. We think about like food and access is one of the things that we've identified through multiple departments, whether that be our WIC department, our home health nursing department, going out into homes that people can't leave and have food equity issues. And then also, obviously, with our harm reduction unit, needing to have food access as well. That'd be just one of, but we have identified several others that we have a need for, but we will be forming our team and trying to meet and wanting to see how the board could engage with us in that, and I'll have Grant and maybe some new board members to help out with that. Yeah.
Good question, Jim. Anybody else? You know, as I'm also thinking out loud with us, with regards to youth mental health and that topic of youth, I hope they'll also look at, and it connects to what Jan and our team, you're also services and homeless and so on, but another big issue in our world, I believe, is that when foster children turn 18, a significantly high percentage of them instantly become homeless. Mm-hmm. And to me, that's a mental health issue and a community issue. So if we can make sure we touch on that topic as well, knowing that reality, how do we address it? And how do we make it better for those young people? Just another topic. Anything else? Okay, Jen, we're done with that topic for the moment. Anything else on community health assessment? We'll move on to open board members' positions and discuss that for the moment. Is that you, Jen, as well?
Yes.
Okay.
So as stated earlier, we have 3 open board member positions. The criteria for the board member positions has been reviewed and by the bylaws that were most recently rewritten in 2023. We are pleased to have received already 11 very qualified candidates. The window for closing of the application period for being a board member will be January 31st, at which time we will continue, we're reviewing them currently. And I believe it's the commission that appoints the next Board of Health members.
Correct. My sense is that as liaison, I will be involved with that, and perhaps administration will be involved with that process. And Dr. Mahoney, as mayor, will also typically engage with running through and vetting candidates. But with three openings, this is a chance for any and all of you to reach out to people you know, and people who would fill gaps or bring additional skill sets to us that would be valuable to us going forward. Don't be shy. A lot of people around here don't volunteer for stuff, so sometimes we have to ask them. So I'd recommend to the board members and people in the community to ask people to step up if they're potentially good candidates for being on the board with 3 openings.
One of the misnomers, I think, has been that people have reported to me like they don't know a doctor who would be good to have on the board or to fill that spot because they think public health and they think medical field. But we have many other divisions within the health department that, like environmental health and emergency preparedness, and sometimes those don't get representation outside of the clinic and other larger, like I know the epidemiological and infection control and those kinds of things are critical and in the medical realm as well as the clinic, but also the environmental aspects of public health work.
And voices of the consumer.
Correct.
You know, the people who are patients are consumers and receive these services and are experiencing it on a daily basis, so there never hurts to have the voice of ordinary people at the table too, speaking experientially. Okay, anything else on, in the timeline again through the end of January, that applications, they go to the website to apply, is that correct?
Correct.
And submit an application and put the word out to people you know.
Can I see the prior slide again?
Did you have a question, Dr. Sears?
I guess in the past, I know we've had someone from the board of school board on there. I know that's doesn't look like that's been a requirement. I was just curious if that's something we're going to continue to have a school board liaison.
Well, that's an interesting topic, and we have 2 school districts here, actually. Maybe that's a topic to consider. There's always room for ex officio liaison relationships too, that, you know, we can contemplate who's not there. But schools are really, that's a good suggestion. Anything else? Okay.
Hold one second.
Hey,
I'm
Jamie.
Sorry, I just wanted to ask what the usual timeline is when there are terms expiring so that we don't have open positions? I mean, this meeting's a little different because we have so many open positions. So is that typical for these types of groups? Or I would assume that we would have people in place when a term ends.
I think it was, to be honest, quite by surprise that the term recognition of ending in 2024 versus 2025, there was I believe, an error on our website that had it indicated at 2025. By a review of all of the records that were through commission and all of the things that had been from 2021, from the time that they became board members, all of the city official records indicated them to be at 2024. And so when we had last met, I think we all left that meeting with the understanding they would be here in January and that we were going to work together through 2025. When I was given notice that the terms were ending in 2024, we did notify them to let them know that their terms were coming to an end at 2024, December 31st. NYMAL had already exited due to other issues. So when they were given notice and had elected to not renew their terms. And so, yes, it would be very much appropriate to have the seats filled before they would be off-going and to have that awareness be in much larger advance notice. The rest of the bylaws that were written in 2023, which I believe your group did write them together, maybe not all of you were present for that, but there's another section to this that, that the board cannot be all male. There needs to be a female, or they cannot be all female either. It needs to be a male. So, and that the people serving would continue to serve until a new appointee had been found. So at this point, given some busyness that had been happening and the options to not continue to serve, we were made aware. So apologies that we did not catch that as a staff, or that members weren't aware, and it ended up now being a smaller board.
And if I recall, Commissioner Preston was sitting on the health board and brought that to the city commission, but this is a moment. But that's solid feedback. And my sense is going forward, we won't be doing the bylaws every year, so we won't be restructuring and we're working on them. So going forward, we'll anticipate changes in advance. Okay. Anything else, Jim?
Nope.
Okay.
I was going to address the fact that some of these people that are now no longer on the board were not aware that their term had expired, so I was curious as to what happened there, but it was well explained.
And in the meantime, we want them to know how sincerely appreciated they were for their public service as well. It's government, the wheels of government. Anything else on this, board members? Okay. All right, we'll go on to item number 6, overview of the Southeast Regional Support.
When we had met, I think, one of our meetings, there was conversation about Fargo-Cass Public Health serving the southeast region of the state in a different number of capacities. And that was new information for some of the board members. I don't know if it's new information for all of you or not, but it was something that we wanted to have an opportunity, and we haven't had that opportunity in previous meetings, to expound on the services that are provided to the Southeast region through Fargo-Cass Public Health. So taking that opportunity today to follow up on that information, and Doug Murphy is on the line to discuss what emergency preparedness does for the Southeast region of the state, which includes Steele, Trail, Cass, Ransom, Sargent, and Richland counties. Doug, are you online still?
Doug's online, okay.
I am. Thank you, Jen, for the introduction. Doug Murphy, Fargo Cass Public Health, Emergency Preparedness and Response. As Jen said, we serve 6 southeast counties. We are fully funded by the North Dakota Department of Health and Human Service Center Emergency Preparedness and Response section. Their funding comes from the CDC. The CDC funds each state, and then each state partitions it out to each region. So we serve the 6 counties. We provide assistance, as you can see on, can they see this PowerPoint, Jen?
They can.
Okay, so I don't need to read it word for word, but we provide assistance to entities who hold people overnight. So it could be a hospital, a group home, a long-term care shelter. It could be people that are in their own home but might need assistance to evacuate or get out of harm's way. That is considered a vulnerable population, and the struggle with that is people in those situations typically don't consider themselves vulnerable, and so they don't. That would be an opt-in, and it's just been a struggle for the 17 years that I've been here. But we would assist them also. What we do work with is those entities that care for those people in their own home. So if they're hospice, there's a hospice care worker. We would work with them to get them out of harm's way. It might be a home health care worker or something like that. It could be Meals on Wheels for us to then know who to reach out to assist those people in a time of need. The ones that are in a care center, we know that. So if they have a power outage or they have the Elam fire 5 years ago, we assisted in getting those people out of harm's way and then placed into care, long-term equivalent long-term care, because they obviously weren't going back into that building. Hunter Huberg currently serves as our Emergency Preparedness and Response, that's EPR, and then EHP is Environmental Health Practitioner, 24/7, 365 for environmental spill response and hazardous material response. So that's for the whole county. Obviously, we have more activity here in Fargo or Cass County, so there is a lot of response there. But the Castleton train derailment would be one of those, where there is an anhydrous plume. We may monitor that plume because it's probably better to shelter in place than it is to have those people evacuate through the plume. And that would be ongoing, that we would monitor that if we have to get them out of harm's way. We provide respiratory fit testing. So during COVID response, we fit tested thousands of individual workers and first responders, so police departments, fire departments, EMS, that type of stuff. We also do train the trainer, where we set them up to be able to test their own staff, because turnover is constant. So just because you tested all of your staff today doesn't mean that in a month from now they would all be fit tested. We provide mass dispensing training for all 6 counties, so the public health units in each of the counties. If we were to mass dispense, whether it's pills or in the case of COVID, it was vaccine. So we were setting up, if you recall, we had the Boardman site where we partnered with the health systems to dispense vaccine. We participate in ongoing training. Currently, we are in, this week, we were in new training that will be the patient tracking, the hospitals for have-bed, long-term care with have-beds. So if somebody is going on diversion, so let's say a hospital is going on diversion, we can't send any more people to that hospital. Maybe we have to offload less acute. So we're learning that whole software, how to send out mass notifications, that type of stuff. And we are 24/7 response. We're exempt employees, and we do respond 24/7, 365. Any questions?
Anybody have any questions, or Jim?
Do you work hand in hand with the emergency managers from each of those 6 counties when you go out like that?
Yes, we actually do, and we used to be officed directly with the emergency managers in Cass County. So currently, Jim Prochniak He currently has my old office. And then city emergency manager or city of Fargo emergency manager, larger cities will have emergency managers. So we work with Brady very closely. They are the ones that think of it as we are part of their emergency plan, where they are the full, so a tornado could hit infrastructure, but no people. That's really going to take them, and they are going to deal with that. They're going to deal with the flooding of the river. We're not front and center. We're front and center where that river gets into people's harms or it affects people's lives. So if we need to get people out of harm's way, that is where we are involved. And we also work across the river because we work with Clay County and their emergency manager and the city of Moorhead emergency manager.
Commissioner Capitan, does that, I'm too informal here sometimes, does that answer your question adequately?
Yes, it does. And also, I'd like to probably recommend Jim Prozniak for membership on here because he's retiring. I think he's this month or next month.
So he's been volunteering.
I think it's in a couple of months, yeah.
Okay. But he would be a good member on this board.
All right. Anybody else? I'm curious, Doug, in your lane, does the definition of emergency change, and are there examples of different types of emergencies that we've just never anticipated before that are now on your radar?
Constant. We always do, and it's led by the county, so that would be Jim's office, where we do a THIRA has a hazardous mitigation plan, and we look to see what is an issue. We may not have hurricanes here, we may not have mudslides here, but we have something else that is we wouldn't have forest fires, but we could have grass fires. We have lots of hazmat coming through on the interstates and on the trains, both directions. The interstates go both directions, and so do the railroads. So we have a lot of that type of stuff that comes through. So we do a lot of planning and testing. If you asked me, let's go 5 years ago, and it doesn't matter, just before COVID, if we are prepared for that, we would have training. The CDC has us do trainings. Yep, we have software that can push out your results. But COVID happens and everything changes. We had to build a response on the fly. As you know, the state lab, your tests had to go to a state lab and be certified. Well, the state lab had to grow and hire people on the fly. So as much as we plan and prepare, we know that we have to be able to pivot and change on the fly. And that's not only us, it's everybody else at Fargo Cass. I can't dispense. So we would go to, I can't dispense a vaccine. So we would go over to Suzanne, Director of Nursing, and we need to partner with her. And how do we do this? How do we give vaccine to the whole population when we're not going to be getting 200,000 doses overnight? We have to prioritize. We may not get what we're supposed to get. And so it constantly changes. We meet every day, and you just have to go with the flow because you can't write a plan as to how the hazmat will happen. It's a long answer, but it changes.
I guess one of my thoughts in the background of that question was someday we may consider fentanyl an emergency. You know, as a crisis, we already know it's a crisis, but I'm just wondering at what point do we consider it emergent or not? But the public health is working on that in every department anyway. Any other questions or feedback?
Yeah.
Doug, where are you located in your office?
I'm located at Fargo Cass Public Health. We now have our own little suite. We used to be in the police substation for the whole time of COVID, which is now where winter warming is, but we're towards the back of the building now.
Okay, and I know Commissioner Kolpak's in the room, but I'm assuming there's a tight relationship, obviously, probably with dispatch?
That we have a tight relationship with dispatch?
Is there or not, or what would the connection be?
Yeah, we would have it through state radio. So if something goes out, and Holly helped me here on this, how that notification happens. If any notification goes out through dispatch, they send it to state radio, or even Jim Prochniak gets something, it gets pushed back, and we all get notified immediately. And the state can push out a health alert. So it could be something that's not even in our region, but we would learn about it.
Yep, I would say you're right. It kind of depends on the nature of the emergency and the type of communication that needs to go out. There are a couple of different channels for that across the state.
Okay. Anybody else? All right, Doug, thank you very, very much for sharing that with us. At this point, we'll go on to the next agenda item, which is public comment. I'm not certain if anybody has signed up, or anybody in the room for public comment. Nobody is?
We have another section for Southeast Regional Support.
Oh, we have another follow. Oh, I'm sorry.
That's right. We just haven't finished it yet.
You got this novice chair today. Bear with me.
Doing a great job, Commissioner.
Thanks.
Welcome, board members. Grant Larson, Director of Environmental Health. I too am just going to paint you a picture here of what environmental health services we do. In order to paint that picture, I thought I'd break it down by different areas. And I'll move left to right here on these diagrams. So starting with the orange, that's what environmental health does for the services in the city of Fargo. And you can read it. I'm not going to read them all, but if you have questions on any of them, I can definitely answer them. Moving right, you can see we have West Fargo. So Fargo has 11. All of our core services are in Fargo. West Fargo, through an MOU, has 6 of those services. And then right below West Fargo, we have Cass County. So Cass County and West Fargo, obviously both in Cass County. And Cass County has 4 services, direct, that support the region when we go out in the Cass County. Aquatic, which is for pools, it's adopted by ordinance. We do some food service in the county. That's through a MOU with the state health department. That's specific for childcare facilities and schools out in the county. Then we do a nuisance compliant program. So if somebody has a nuisance that's deemed a health hazard in the county, we use the North Dakota Century Code to enforce that as needed. One of the main bread and butters out in the counties is the on-site sewage treatment system program. That is adopted by ordinance in Cass County. We move to the next county in the region, Richland. As you can see, they have aquatics that have been adopted by ordinance, so they're required in that county. The nuisance program we still do by Century Code. On-site sewage treatment is also adopted by ordinance in that county. Moving to Ransom, the aquatic program was adopted by ordinance. Once again, we have a nuisance program as needed. However, the on-site sewage treatment system program was not adopted, and that either is adopted by the commission in that county or the Board of Health. And so they chose not to adopt it, but our services are available. If you want our services there, and if we have to do an evaluation of a system or a new permit, we can definitely help them in that county. Trail County has the pool program is adopted, or is not adopted, excuse me, by ordinance, but we can do advisory there. So if they want advisory or education, we're obviously going to use our expertise to get it to them for their education, to run their pool programs. Nuisance, same thing, Century Code. On-site sewage treatment system there is adopted by ordinance, so that is required and we do enforce it. Moving on to Steele County, the next column, aquatic program is not adopted. Nuisance is the same. And then the on-site sewage treatment is also not adopted in the Steele County, but we can provide services as needed or as requested. Sargent County has not adopted the pool program or aquatic program, so we advise. Once again, same on nuisance, and then on-site sewage treatment system is adopted by ordinance in Sargent County. So I wanted to break that out kind of by each county and services that we provide currently. Can I answer any questions?
Help me understand, do these services get based out of Fargo Cass Public Health and then disseminate out to the region, Grant?
Correct.
That's how that works?
Correct. So my personnel environmental health practitioners that are board certified would go out to these counties as needed to provide these services. Correct. So all of our staff is located in the building, and then we go out, whether it's West Fargo or Richland County or any other county. If we need to go out there, we drive out there and then come back.
And programs and supports you have locally that they don't have, do you kind of fill those gaps for them? And we resources for them, or?
as far as in the counties.
Yeah.
At this time, no, we only specifically focus on the education regulation in Fargo and West Fargo. If they wanted, they're again advisory and consultation, but we have no jurisdiction in those areas, right? And they've chosen, they're not offered, those programs aren't offered there. If they want to adopt them once again through the Board of Health or their ordinance, we'd surely be able to provide those services through that region. But at this time, these are the only services that have been adopted.
Okay, it's really expansive. Any board members, questions, feedback, suggestions? What's a nuisance complaint program? What's an example of it? Is it like public nuisance or health nuisance or like mosquitoes or?
Well, the biggest one in Fargo is the grass and weeds, which is, 1,000 complaints that are driven each year. When you move out in the counties, it's blighted buildings. It's rodent harborages. It's excess amount of tires that might harbor mosquitoes that, that can get water in those tires and that can be a breeding ground for mosquitoes. And there again, the Century Code, and there's a different process to bait those that we have to go through townships and then through the county because it becomes on, if there's going to be a cost associated with that abatement, it has to be fully funded through whoever the channel, if it's a county or township, where that property is located.
I recall a few years ago at State League of Cities, there were discussions about sometimes you resort over to public health Century Code statutes to get a property cleaned up or something. That was an area they would get some resolve versus have a blighted property that's just a mess for the community. But that was just one story I remember hearing, that go to public health.
You're correct. We always go down to the local level. If that county or that township doesn't have an ordinance, then we have to go to Century Code to abate that. There again, Fargo has very, good ordinance as far as against nuisances. And the county, they might not have this structured nuisance plan or ordinance. So then we go to Century Code.
Good. Anybody else? Any questions, feedback? Thank you very, very much.
You bet. Thank
Now, Jen, are we done with that topic?
I'll just say that the first Friday of every month, we attempt the local public health administrators and I meet, as well as environmental health directors and the emergency preparedness directors and Holly, meet to review the regional needs and what our future plans are and any current issues that exist. And so we also get a different allocation of money and funds to support the Southeast, all of us together as a Southeast region. In this coming year, we'll be looking at forming a one-page, a one website link to Credible Mind and optimizing Credible Mind as a healthcare or mental health resource that some of the counties had, but not all of the counties have had. And this would be monies that would be spent towards that. We also would collaborate on trainings that we might do at FargoCast that others might not do. So we'll collaborate on a training program and support each other in those ways. And we'll meet every year to create a new contract to what are the needs of the region and how do we then spend that money that we get. So that's a mutual opportunity. Kayla and Brenda are here from the other counties in the region as well. If you would, I know they probably didn't sign up for a public comment, but if they're here and they want to chat with you afterwards, they could.
All right. Anything else on that? Okay. Any public comments at all? I think there's nobody signed up. Did you folks want to make any public comment? If not, our next meeting date will be April 4th. I welcome Dr. Lindeman to the program again. You're not unfamiliar here with everybody and look forward to working with you. And Dr. Severson, and thank you for volunteering to be on that working task force. And all of you, please suggest to folks to apply for the board so we get as broad a selection of people. And Commissioner Capitan, you have something to say?
Well, I'd just like to say that Dr. Lindeman, which I knew the family very well. We grew up, lived together up on the north side of Fargo for years, and Dr. Jesse was a good friend of my daughter and went to school at Longfellow and Ben Franklin and Fargo North, and now she's grown up and is a doctor herself. So.
We're dating ourselves.
Yes, we are.
All right. Anything else for the good of the order? If not, we'll stand adjourned. Thanks, everybody.